Hello friends. Hello friends. I hope you all can see me. Patel, Heth Patel. Yes. So yeah, I think I'm visible now. And sorry for the loss of time. It was my first ever live broadcast. So some technical glitches. Can you see me now? Snehajit, Heth Patel, Alladita ji, my favorite students. Thank you for giving me moral support. Um, First ever live stream on my channel. Okay, uh, Dhanashri Sathe. Okay. Good evening. So you all can see me and hear me, audible, visible. Can we start now? Chalo. Uh, we are starting off a new section on our channel, YouTube channel, which is going to be the Physiology Live. Sunday 5 Physiology Live. One MCQ, one concept every weekend. So that's going to be a new feature added from today on our channel. And why live? Because I have been coming to the recorded videos also, but then live का एक और मजा होता है, मतलब you allocate that time, and it's going to be a conceptual discussion, not more than 10-15 minutes. We will discuss one MCQ of the week and an important concept. All right. Okay. Good. Great to see you all. And without wasting any further time, let's start our discussion. So this week I had asked this MCQ on all my social media platforms, and let's have a look at the MCQ. A 40-year-old healthy male went into cardiac arrest some 10 minutes ago. He was on treadmill and he went into cardiac arrest. Now, what will be the pressure in his vessels if you record it after 10 minutes? Many students ask me this question. Many students asked me, sir, cardiac arrest means the guy must have passed away some 10 minutes ago. His heart must have stopped. So what's the point in measuring the blood pressure anyways? I mean, if the person is no more. Look, if it was that simple, then I wouldn't have asked you the MCQ. Options were 0 mm of Hg, 7 mm of Hg, 20 mm of Hg, and 36 mm of Hg. And I know many people first thought 0 mm of Hg as logic would suggest that 0 ही होगा ना, heart has stopped beating, and then people apply logic. If it was 0, it must not have been that simple. So then they take the next closest value, and that is 7 mm of Hg. Well, yes, by that logic, you go to the correct answer, but that's not the logic actually. Why it's 7 mm of Hg? So we will discuss this MCQ, and with that, we will discuss two important concepts in the cardiovascular system. So I welcome you all. Okay. Welcome, Fun G. Thank you for saying this. Okay. So, the concept in that MCQ, when the heart has stopped beating, what will be the pressure in his circulatory tree? The answer was 7 mm of Hg, and the concept is mean circulatory filling pressure. Also, some people thought ke iska what is the clinical significance if the person has died? Who cares what's the pressure in the circulatory tree, 7 mm of Hg or 0 mm of Hg? What is the clinical importance of that? I am going to tell you the importance also. It has clinical significance, this concept of mean circulatory filling pressure. So we are going to discuss two pressures in the circulatory tree and their clinical significance. All right. Okay. So let's start. First pressure. Well, I am going to take the MCQ answer and explanation as the second one, mean circulatory filling pressure. First concept that we will see today is mean arterial pressure and its clinical application, its clinical significance. So let's start. What is mean arterial pressure? Okay, before we start, let me just tell you these two pressures that we have taken for today's discussion. One is when the heart is beating and the other one is when the heart is stopped. Okay, so first, mean arterial pressure is when the heart is beating. So what is mean arterial pressure? Mean matlab average. Okay, in simple language, mean means average. So we are talking about average pressure in the circulatory tree. Okay, and what is average? Look, heart is alternately going into systole, diastole, systole, diastole, systole, diastole. So we have in our circulatory tree two pressures, systolic pressure and diastolic pressure. Okay, we have two pressures, systolic pressure, systolic blood pressure and diastolic blood pressure. So obviously the average would be the systole, average would be the average of systolic BP and diastolic BP. Let's write it here, average of systolic and diastolic blood pressures. That would be the average pressure in the circulation. जब हार्ट बीट कर रहा है तो सिस्टोल डायस्टोल ये दो चीजें कर रहा है, और सिस्टोल के वक्त प्रेशर होता है, डायस्टोल के वक्त प्रेशर होता है, और इन दोनों प्रेशर्स का एवरेज, दैट इज द मीन आर्टीरियल प्रेशर और एवरेज प्रेशर इन द सर्कुलेशन. अब हम एक फिगर्स लेंगे, आर्बिट्ररी फिगर्स, और एवरेज निकालने की कोशिश करते हैं. देखो, लेट्स से सिस्टोलिक ब्लड प्रेशर किसी पर्सन का इट इज 120 mm of Hg, डायस्टोलिक बीपी इज 80 mm of Hg. तो आप एवरेज कैसे निकालते हो? सिस्टोलिक ब्लड प्रेशर ये है, डायस्टोलिक ब्लड प्रेशर ये है, तो इसका एवरेज आप कैसे निकालते हो? 120 plus 80 upon 2, that is 200 upon 2, that is 100 mm of Hg. That will be the arithmetic average of these two figures. बराबर? अगर हम arithmetic mean या arithmetic average निकालना चाह रहे हैं तो वो 100 के आसपास आएगा. फाइन. लेकिन फॉर्मूला जो है, mean arterial pressure has got certain formula. This formula you will have to by heart. Mean arterial pressure is equal to diastolic BP plus 1/3 of pulse pressure. एक बार मेरे शांति के लिए, मेरे समाधान के लिए बाय हार्ट करो, बोलो मन में. Mean arterial pressure is equal to diastolic BP plus 1/3 of pulse pressure. अब ये इतना convoluted formula क्यों है? I am going to explain that. Okay, that's going to be the crux of this particular discussion. Diastolic, एक बार रिपीट कर दो फिर से मेरे लिए. Diastolic BP plus 1/3 of pulse pressure. Right. What is pulse pressure? What is pulse pressure? It is the difference between systolic and diastolic blood pressures, right? So in this case, what is the pulse pressure? 120 और 80, इनके बीच का डिफरेंस मतलब 40 mm of Hg is the pulse pressure, right? In this case, हमारे arbitrary figures में. अब हमारे अरिथमेटिक मीन हमने जो निकाला था वो था 100, 120 और 80 का अरिथमेटिक एवरेज या अरिथमेटिक मीन कितना आया था? 100. हमने कैसे निकाला था वो? अब थोड़ा सा ध्यान देना इसके तरफ, ये इंपॉर्टेंट पार्ट है. हमने कैसे निकाला था? 120 plus 80 upon 2, ऐसा अरिथमेटिक एवरेज निकाला था हमने. 200 upon 2 and that's 100. तो ये 100 जो मीन है ना, मिड पॉइंट, एग्जैक्ट मिड पॉइंट ऑफ 120 एंड 80, इसके पास पहुंचने का एक और तरीका है. गौर से सुनो. एक तो हमने ये तरीका किया 120 plus 80 upon 2, that is 200 upon 2 and that's 100. एग्जैक्ट मिड पॉइंट. एग्जैक्ट मिड पॉइंट तक पहुंचने का एक और तरीका है. क्या है? देखो, 80 जो डायस्टोलिक ब्लड प्रेशर, इसमें आप जब पल्स प्रेशर पूरा ऐड करते हो, पल्स प्रेशर जो डिफरेंस 40 mm ऑफ Hg, वो पूरा ऐड करते हो तो आप पहुंचते हो 120 mm ऑफ Hg। और अब सुनो, डायस्टोलिक प्रेशर में इफ यू ऐड हाफ ऑफ पल्स प्रेशर, डायस्टोलिक बीपी में यानी 80 में ऐड हाफ ऑफ पल्स प्रेशर यानी 40 का हाफ यानी 20। देखो ना, 80 में आप 20 ऐड कर दो तो आप कहां पहुंच रहे हो, 80 प्लस 20, यू रीच एग्जैक्ट मिड पॉइंट। समझ रहे हो इस बात को? डायस्टोलिक ब्लड प्रेशर प्लस पल्स प्रेशर पूरा इज इक्वल टू सिस्टोलिक ब्लड प्रेशर, है ना, क्योंकि दोनों के बीच का डिफरेंस इज द पल्स प्रेशर। डायस्टोलिक बीपी प्लस हाफ ऑफ पल्स प्रेशर, यू एग्जैक्टली रीच हाफ वे मार्क। सीधी बात है, सिंपल बात है, डायस्टोलिक बीपी प्लस हाफ ऑफ दिस डिफरेंस एंड यू रीच हाफ वे मार्क बिटवीन द टू एग्जैक्टली। सो another way of reaching the halfway mark between the two pressures is this कि diastolic BP में half of pulse pressure, आधा pulse pressure ऐड कर दो, 20 ऐड कर दो, आप 100 पे आओगे, which is exact arithmetic mean। अब समझे, डायस्टोलिक बीपी प्लस हाफ ऑफ पल्स प्रेशर एंड यू रीच अरिथमेटिक एवरेज। और हमने यहां पे फॉर्मूला क्या लिया है, एक बार मेरी शांति के लिए फिर से एक बार रिपीट कर दो। चलो, क्या कहा था हमने, मीन आर्टीरियल प्रेशर इज इक्वल टू डायस्टोलिक बीपी प्लस 1/3 ऑफ पल्स प्रेशर। हाफ ऑफ पल्स प्रेशर नहीं कर रहे हम, 1/3 ऑफ पल्स प्रेशर कर रहे हैं। ओके, अब इसके पीछे की कहानी सुनो, जस्ट सी दिस, व्हाट इज इन दिस केस 40 इज द पल्स प्रेशर, डिफरेंस बिटवीन द टू प्रेशर्स 40 है वो पल्स प्रेशर, उसका 1/3 कितना आ रहा है, रफली 40 का 1/3, हाँ 13, हाँ, तो 80 डायस्टोलिक बीपी, उसमें 1/3 ऑफ पल्स प्रेशर ऐड करो, यानी कितना ऐड करोगे, 13, 80 प्लस 13, 40 का 1/3, हाँ 13 बराबर, तो 80 प्लस 13 आप पहुंच रहे हो, यू आर रीचिंग 93 mm ऑफ Hg। तो अब अगले 2 मिनट बिल्कुल ध्यान से मेरी बात सुनो, बिल्कुल ध्यान से। ओके, वी सेड द फॉर्मूला फॉर एवरेज प्रेशर इन द सर्कुलेशन इज डायस्टोलिक बीपी प्लस 1/3 ऑफ पल्स प्रेशर। एंड व्हाई डिड वी टेक डायस्टोलिक बीपी प्लस 1/3 ऑफ पल्स प्रेशर, व्हाई नॉट वी टुक हाफ ऑफ पल्स प्रेशर? बिकॉज by adding 1/3 of pulse pressure, that is 13, you are reaching at 93. That means by the formula, our mean arterial pressure, our average pressure in the circulation is slightly closer to the diastolic blood pressure. 93 is slightly closer to the diastolic blood pressure. फिर से सुनो एक बार, 100 the arithmetic average, systolic or diastolic का arithmetic average 100, which was exact equidistant between the two pressures. 100 is exact midway between 120 and 80, but 93 is slightly closer to 80, slightly closer to the diastolic blood pressure rather than the exact arithmetic average. So now I am making an important statement. Mean arterial pressure, that is average pressure during the cardiac cycle or average pressure in the circulation when the heart is beating, it is not the exact arithmetic mean or exact arithmetic average. It is slightly closer to the diastolic blood pressure. We are getting it by this formula. And now the only question that needs to be answered is why? ऐसा क्यों? ऐसा इसलिए क्योंकि so I have just written this, why MAP is not the arithmetic average, exact midpoint, but why it is closer to diastolic blood pressure is because diastole is for longer duration in the cardiac cycle. मैं आपको एक just quickly बता देता हूं समझाने के लिए। Suppose आपकी कार्डियक साइकिल 0.8 सेकेंड्स का ड्यूरेशन है, बराबर, कार्डियक साइकिल 0.8 सेकेंड ड्यूरेशन। अगर पूरे 0.8 सेकेंड्स के लिए डायस्टोल चल रहा है, सपोज जस्ट एग्जांपल दे रहा हूं, पूरे 0.8 सेकेंड्स के लिए डायस्टोल चल रहा है, तो एवरेज प्रेशर क्या रहेगा, डायस्टोलिक प्रेशर, वही एवरेज प्रेशर ही रहेगा ना, डायस्टोल चल रहा है पूरे 0.8 सेकेंड्स के लिए, 80 mm ऑफ Hg ही है, तो वही एवरेज प्रेशर रहेगा, सीधी बात है। अगर सिस्टोल 0.4 सेकेंड्स और डायस्टोल 0.4 सेकेंड्स ऐसा रहेगा, आधा आधा रहेगा ड्यूरेशन अगर दोनों का, 0.8 सेकेंड्स में आधा टाइम सिस्टोल आधा टाइम डायस्टोल, तो एवरेज प्रेशर क्या आएगा? एवरेज विल बी द एग्जैक्ट अरिथमेटिक मीन या एग्जैक्ट अरिथमेटिक एवरेज ऑफ द टू प्रेशर्स. लेकिन रियलिटी इज in the cardiac cycle, diastole is for longer duration, 0.5 seconds, and systole is only for 0.3 seconds. And because diastole is for longer duration, therefore when you take out the average of systolic and diastolic blood pressures, it is slightly closer to the diastolic blood pressure rather than the exact arithmetic average. Is that clear? Is that clear to you all? Is that clear? एक बार thumbs up दिखा दो so that I can go ahead. I hope you have understood the concept that I'll just summarize the concept. Mean arterial pressure is the average pressure in the circulation when the heart is beating. Okay, when the heart is beating, it is systole, diastole, systole, diastole. So we have two pressures, systolic pressure and diastolic pressure. And the mean arterial pressure is the average pressure of these two pressures. But it is not the exact arithmetic average. It is slightly closer to the slightly closer, 93. It's not 100, it's 93. Slightly closer to diastolic blood pressure. Why? Because diastole is for a longer duration in the cardiac cycle. Simple. Okay, so I hope you have understood, and that's great. Great to see you all boosting my morale actually. Het, Snehajit, Alladita ji, Fun ji, अनिरुद्ध प्रभु, थैंक यू वेरी मच. मेरे फेवरेट स्टूडेंट्स है ये सब, ऑल टाइम फेवरेट स्टूडेंट्स, एंड माय फर्स्ट लाइव स्ट्रीम, तो मुझे मॉरल, दे आर रेजिंग माय मॉरल. ओके, ग्रेट ग्रेट, थैंक यू वेरी मच गाइज. ओके, नाउ clinical importance of mean arterial pressure. What is the clinical significance of mean arterial pressure? It is a critical hemodynamic factor. Those who have gone to second year, Snehajit, Het Patel, Alladita ji, you have gone to second year. Now you have started with medicine. So they will ask you, what is the clinical importance of mean arterial pressure? Why do you have to know the average? This is the clinical importance. Critical hemodynamic factor. This is a critical hemodynamic factor, the average pressure in the circulation. It is a major determinant of perfusion pressure. You know, mean arterial pressure से हमें क्या समझता है? तो टिश्यूज में परफ्यूजन एडेक्वेटली होगा कि नहीं होगा, ये हमें मीन आर्टीरियल प्रेशर से मालूम पड़ता है. Okay, so medicine people, just note this point, that mean arterial pressure is the major determinant of the perfusion pressure, whether the tissues are adequately perfused or not. If there is a low mean arterial pressure, then inadequate blood flow to the organs, that's a possibility. That is when there will be low mean arterial pressure. There is a possibility of syncope, fainting attack, because brain is not getting enough blood supply, or person may go into shock. In the shock conditions also you will see mean arterial pressure is low. On the other hand, if it's a high mean arterial pressure, more than 90, actually more than 96 mm of Hg, if it is higher than that value, then it's a higher risk for cardiovascular diseases and stroke. Heart के ऊपर burden आ सकता है, stroke के chances बढ़ते हैं if mean arterial pressure remains high for longer durations. So that's the clinical importance of mean arterial pressure. Now let's go to the next pressure, and that is mean circulatory filling pressure. I hope you all are listening. So thank you very much once again for joining me on this Sunday live. Let me just add before we continue further, and it's only a matter of 5-10 minutes now. Every Sunday morning, I'm going to take a quiz contest, and there will be grand prizes to win. Okay, first 5 correct answers with explanations will get grand prizes. And in the evening, it's going to be a Sunday live, Sunday 5 Physiology live. 1 MCQ, 1 concept, and strong. Let's make the subject strong. Physio, pharmac, medicine, everything will be strong. Okay, so yeah, additional one more point. This is good for first prof students to make their concept strong. This is equally good for second year, third year, and even for PG entrance exams. Those who are planning to give PG entrance exams, yes, even for them, 15-20 minute का session होगा every Sunday, only 15-20 minutes, but it will give you good insights into the subject. All right. So now second, वो अपना MCQ. When the person is dead, what will be the pressure in his circulatory tree? What will be the pressure in his arteries? This MCQ was asked in the DNB entrance exam some 5-6 years ago. So let's see. As I said, that mean arterial pressure was the average pressure when the heart was beating. Now we are seeing average pressure in the circulation when the heart has stopped beating. Okay, and I'll give you the answer to that question. People ask me, sir, if the person is no more, what is the point in checking the blood pressure? It's not about person being no more. The concept is mean circulatory filling pressure. So it is actually recorded even during when the person is alive. Okay, so let's see. First of all, when the heart stops beating, the pressure equally distributes in the circulatory tree. So blood will get redistributed again. Look, when the heart is beating, when the left ventricle is creating that pressure head and the pressure head is driving the blood throughout the circulatory tree, that is when the heart was beating and systolic and diastolic pressures. Now the left ventricle has stopped beating. Imagine this. So there is no pressure head generated by the left ventricle. Now what happens? Okay, even before that, let's just see what happens during life. When the LV is beating, artery में the pressure is 90 to 100 mm of Hg, average pressure. Capillaries में pressure है 15 to 20 mm of Hg. Veins में pressure है 10 mm of Hg. So different segments of the circulatory tree are showing different pressures. Also blood volume, check it out. Blood volume. Veins has almost 60% blood volume. Normally, I'm saying when the heart is beating, more than half the blood is in the venous system. Then arteries have 10 to 15% blood volume, capillaries have 5 to 8% blood volume. So this is the distribution of pressure and blood volume when the heart is beating. Now consider the heart has stopped beating. Heart has stopped beating. Now the only pressure in the circulatory tree, अभी तो left ventricle तो pressure head generate नहीं कर पा रही है. In that case, the only pressure in the circulatory tree is the tissue pressure. Capillaries are there in the tissue and tissues have certain compression on the vessels. So that's the only pressure on the circulatory tree. Do you know how much is the tissue pressure? Come on, how much is the tissue pressure? 7 mm of Hg. So what happens now is that the blood volume, now when the heart stopped beating, entire blood volume again gets redistributed in the entire circulatory tree. It just fills the circulatory tree. अब ये सिर्फ circulatory tree को fill करेगा. Flow नहीं कर रहा अभी वो. Stopped है, flow नहीं कर रहा. बस ये भर जाएगा पूरी circulatory tree में और उसका pressure will equilibrate with the tissue pressure which is about 7 mm of Hg. और इसलिए मीन इसको कहते हैं मीन सर्कुलेटरी फिलिंग प्रेशर कि भाई जस्ट ब्लड इज फिलिंग द एंटायर सर्कुलेटरी सिस्टम. हाउ मच विल बी द एवरेज प्रेशर? द आंसर इज 7 mm of Hg. Distribution of blood equally in various segments and the pressure, mean circulatory filling pressure is 7 mm of Hg. Okay. Now अभी आप पूछोगे कि सर पर्सन इज नो मोर, तो आप प्रेशर चेक करके फायदा क्या? मुझे बहुत सारे स्टूडेंट्स ने ये सवाल पूछा तो उसका आंसर अभी देने जा रहा हूं. सबसे पहले मीन सर्कुलेटरी फिलिंग प्रेशर कैन बी रिकॉर्डेड और कैन बी मेजर्ड एट बेड साइड ऑल्सो. इट इज डन जनरली. नाउ द ओनली क्वेश्चन इज व्हाट इज द पर्पस? क्यों करते हैं आप मीन सर्कुलेटरी फिलिंग प्रेशर? इट इज टू चेक द वैस्कुलर कैपेसिटेंस. प्लीज नोट, स्नेहजीत, हेत पटेल, आप सब लोग सुन रहे हो ना? आई होप कि ऑल आर देयर एंड लिसनिंग बिकॉज अब आप क्लिनिकल साइड को गए हो तो यू विल रिक्वायर ऑल दीज थिंग्स. क्लिनिकल एप्लीकेशन. सो व्हाट इज द क्लिनिकल एप्लीकेशन? Mean circulatory filling pressure tells you about वैस्कुलर कैपेसिटेंस और वैस्कुलर कॉम्प्लायंस। देखो ब्लड तो फ्लो नहीं कर रहा, ब्लड स्टॉप्ड है, बस ब्लड वॉल्यूम इज फिलिंग इन द एंटायर सर्कुलेटरी ट्री इन वेरियस वैस्कुलर सेगमेंट्स। तो ये कितना भर सकेगा, कितना ब्लड वॉल्यूम हमारे सर्कुलेटरी सिस्टम में भर सकेगा और वेसल्स कितनी उसको एकोमोडेट कर पाएगी, दैट डिसाइड्स द मीन सर्कुलेटरी फिलिंग प्रेशर। तो यहां मैंने कहा है it tells you actually about the vascular capacitance और vascular compliance कि भाई वेसल्स कितना कॉम्प्लायंट हो सकती है और कितना ब्लड वॉल्यूम आप ऐड कर सकते हो इन द सर्कुलेटरी सिस्टम। ओके, तो as more fluid enters the circulatory system, the MCSF, mean circulatory filling pressure, will increase, it increases। तो इसका क्लिनिकल एप्लीकेशन ये है कि अगर आपने फ्लूइड दिया बहुत सारा तो मीन सर्कुलेटरी फिलिंग प्रेशर इंक्रीज होता है। तो आप ये चेक करना चाहते हो कि आप एक पेशेंट में, एक पर्सन में कितना आईवी फ्लूइड दे सकते हो, क्या उसकी वेसल्स उसको एकोमोडेट कर पाएगी। तो ये सब हमको पता चलता है बाय मीन सर्कुलेटरी फिलिंग प्रेशर। सो as more fluid enters the circulatory system, the mean circulatory filling pressure increases because of increase in the elastic energy within the system. So clinical significance of this is for the addition of fluid. It tells you whether you can add more fluid, you can give fluid to the patient. And I'm not talking about the patient who is no more, who has just passed away, whose heart has stopped beating. No. Patient who is in hospitalized or in ICU, and you try to determine how much fluid can be accommodated in the patient's vascular tree. To understand that, we check on a bedside mean circulatory filling pressure. So it is measured even in live patients, of course it is measured, and it tells you how much fluid can be given in the conditions of shock or in conditions of various other conditions. So that was today's live. Sorry, actually I was little rattled initially. 5 minutes it was not working, 5-7 minutes, but you were patient and listening to me. So thank you very much to encourage this. So remember, Sunday 5 physiology is going to be live, and one concept, one MCQ, and we will make the subject stronger and stronger. Thank you. Bye bye.